We're going to talk about the item 7, governance and partnership matters. And without further ado, I'll give the word and the floor to Gabrielle, who's going to introduce us to this, and then we'll take it from there. Gabrielle, the floor is yours.
Thank you so much, Chair. And first, I would like to thank all those member states who spoke in the previous session about the utility of the accountability report. This year's accountability report is its 3rd edition and is increasingly, we hope, becoming an important tool to strengthen our accountability and transparency to you, the member states. Open and transparent information on how we're structured, resourced, managed and governed is especially critical in the current challenging context of cost containment measures, reprioritisation and restructuring. Building on the feedback we received from RC74 last year and also from SCRC32, as well as an independent review, we have endeavoured to continue to evolve the report, which this year has been written against the backdrop of the current financial challenges we face. We've also taken the step this year of realigning the sequence of the document with the agenda of the RC75 session. We hope that this year's accountability report is a further step towards joint accountability and participatory governance, and look forward to your comments on the report during this session. As reported in the section of the accountability report relating to governing bodies, this year has seen us in the Secretariat, with the oversight of the Standing Committee, taking forward the implementation of the standard operating procedures for the establishment, renewal and discontinuation of GDOs, geographically dispersed offices. WHO's Europe's strategy for GDOs, adopted in decision RC62-2, is the mandated document governing the establishment and functioning of geographically dispersed offices in our region. It provides guidance on GDOs, clearly describes their role and function, as well as the main managerial actions and procedures that are required. The 2012 GDO strategy defines the role and functions of GDOs as being to generate knowledge, collect and compile evidence and advice for policy, and conduct the research for the regional offices' policy programmes to support their implementation and capacity building. The strategy also outlines both the prerequisites and the principles of establishing a GDO. Further, the strategy for collaboration between WHO Europe and member states, adopted at RC72 in Israel, identified the GDO structure as one of a number of regional resources to contribute to EPW implementation. In its decision at that regional committee, the decision asked the regional director to ensure where new structures are under consideration, governing bodies are appropriately engaged. We took this forward into the 5-yearly governance review in 2023, and consultations on the review resulted in the SOPs presented to RC73. And here I would like to thank our governance consultant, Dr. Michaela Told, who's been with us as both a constructive friend, but also a constructive challenger throughout this journey. RC73 advised that SCRC31 take forward the recommendations of the governance review, including further consultation with member states as necessary. This resulted in refinements to the standard operating procedures, which were endorsed through the SCRC31 report to RC74 last year. It has been a journey of a number of years together to ensure that member state decision-making is at the centre of this process. And it's in this context, and as we reported in the accountability report, that we have taken forward the implementation of the SOPs this year, including developing new processes for GDO renewals and consideration of business cases for new GDOs. Those standard operating procedures make provision for either the Secretariat or a member state to come forward with a proposal for a geographically dispersed office, and 3 proposals are tabled for this session: one on healthcare and patient safety, one on artificial intelligence, and one on health and the wellbeing economy. SCRC32 considered these proposals at its 4th meeting in July and assessed them positively from a technical perspective. Accordingly, and in line with the SOPs, we initiated a consultation process with member states from the 18th to the 29th of August to receive comments on these business cases. The feedback received is summarised in the member states' consultation report, which was made available in document RC75-25. The comments received can be clustered in 5 large thematic blocks, concerning strategic alignment with EPW2 and the ongoing restructuring process, governance, institutional arrangements and accountability of GDOs, financial implications, sustainability and management of GDOs, the process of establishing GDOs and GDO oversight, and technical and thematic considerations for the GDO business cases that have been proposed. Regarding strategic alignment with EPW2 and the ongoing restructuring process, any activities linked to a possible new GDO are identified as resource contingent rather than critical in the final version of EPW2 that you adopted just a little earlier. We have sought to clarify our new structures through the Programme Budget 26-27 Outlook document, as well as the new organogram that we posted on our website last week, which demonstrates how existing GDOs are fully integrated into technical divisions in line with the GDO strategy. Governance, institutional arrangements, oversight and accountability of these GDOs, together with financial sustainability considerations and management matters, are set out in the 2012 strategy and reinforced through the SOPs endorsed last year. This includes annual and 5-yearly reporting requirements, with the most recent 5-yearly report being put forward to the RC last year. May I have the slides, please? I realised I forgot a slide along the way, so we'll just pass that slide and go to the second one. Next slide, please. There have been questions in the feedback about what would happen if these business cases were considered positively by the Regional Committee. At this stage, in line with the SOPs, RC75 is asked to consider the validity of each of the proposed business cases. This means that the RC is asked to consider the technical need and relevance of each of these business cases. For maximum flexibility for Member State consideration, we submitted 3 separate decisions, one for each business case. A positive decision on a proposed business case would mean that the RC endorses the issuance of a call for expressions of interest to host the proposed GDO. And this is done under the oversight of the Standing Committee, which would be SCRC 33. SCRC 33 would then review any expressions of interest received, and then the matter would come back to RC 76 for final decision. Accordingly, there are 2 decision points in this process. The decision that we've tabled for consideration at this session, which is technical in nature, and a final decision on a potential hosting country would be for RC76. I hope that clarifies both the history of some of this process. Some of us have been working on this for a long time in different ways and different means. So I hope that summarises the process that we've undertaken and clarifies the process ahead should those proposed business cases or any one thereof be considered positively by the Regional Committee. I would like to pass over to my colleagues, Natasha and Gundo, starting with Gundo, please, in relation to the technical aspects of these proposals. Thank you.
Thank you, Gabrielle. So amongst the proposals before you today on GDOs, the GDO on quality of care and patient safety stands out as one that builds most directly on an already established work stream. The project on quality of care and patient safety that WHO Europe has been implementing in and with Greece since 2021. That project has already delivered tangible results. Initially very much focused on Greece, the office has increasingly brought together countries from across the region to share and improve their quality and patient safety strategies, to develop regional frameworks for measurement and learning, and to build a growing community of practice that now connects policymakers, clinicians, patients, and academics across the region. So the proposed office would take this success to the next level and provide a permanent hub of excellence. Importantly, this is not about creating new layers of structure. The office would be fully integrated within WHO Europe's technical divisions, connecting the dots between prevention and treatment, innovation, service delivery, and systems performance in line with the priorities of EPW2. So the proposal to establish a GDO on quality of care and patient safety before you is an invitation to build on what works and to ensure that the European region remains a global leader in quality of care and patient safety so that every person in every country benefits from care that truly meets their needs. The second proposed GDO that I would like to briefly talk about is a GDO on health and the well-being economy. This also builds on a startup work already undertaken, and particularly by the GDO on investment for health and development, which is located in Venice. Many of you will remember WHO's high-level forum on health and the well-being economy in April 2023, in which 32 of our member states participated. And since then, the Venice office has supported approximately 20% of Euro countries to incorporate health priorities into routine economic analysis, in multi-country policy dialogues, and in capacity building for health and economy leaders to align health and economic decisions on themes such as healthy aging or youth mental health. In consultation with the Italian hosts and the decision of the SCRC in July 25, the technical focus of the Venice GDO looking forward will be on delivering the EPW2 priority on healthy aging and leaving no one behind. Also, we recognize that grants that funded the startup work on the well-being economy are expiring in the year to come. However, the demand is not going away. On the contrary, during the EPW2 consultations, we heard strongly how the misalignment of health and economic financial systems and decisions is leading to high health and welfare costs and missed opportunities to improve health and well-being. The interest was also confirmed last year through the World Health Assembly resolution on economics of health for all, which we noted was co-sponsored by 11 of our member states here in the region. So in a scaled back and leaner euro, the proposed new GDO is an opportunity not only to keep this work alive, but to grow it further in response to the increasing interest in this area. The GDO's unique focus will be on generating the evidence and build capacity to align health and economic and fiscal systems in support of implementing prevention and health promotion priorities across the whole of EPW2, strengthening Euro's capacity to deliver impact in countries. Thank you, and with this, maybe I'll hand over to you, Natasha.
Thank you, Gundo. And I am going to speak to the need for a GDO on artificial intelligence. And I believe that at this point, the proposed GDO really represents a decisive moment to consolidate what is already WHO Euro's leadership in one of the potentially fastest evolving and transformative areas in public health and health systems. The potential is huge, but the risks are also great. And this is what many countries are struggling with at the moment, finding ways to harness the potential and avoid the risks. Let me just remind you that the technical need was already foreseen more than 2 years ago. And at that time, we had presented a concept for the GDO to the SCRC, which was considered technically needed and sound, but it had been agreed to postpone the decision because of the reasons so well outlined by Gabrielle in terms of the governance review process. This was before generative AI had taken the world by storm. So earlier this year, we found ourselves having to rewrite the business case considerably to take into account the fact that the world had changed since we had first developed the business case 2 years ago. And AI already in your countries is influencing clinical decisions, population health surveillance, and public trust in health and health systems. So what will this GDO add? This GDO will allow us to implement and respond to the needs to ensure that all countries across the region have access to expertise that will allow them to benefit from safe, ethical, and equitable use of AI. Let me share with you the fact that we have carried out a needs assessment together because you have responded to our member state survey asking you what you are doing and what are your needs so that we can adapt accordingly. And we will publish this needs assessment in a few weeks from now. We are in the editing and layout stages of the report. But I will share with you the picture, and it's 50 out of 53 member states who have responded. So I'm very grateful to all of you who have taken the time. Only 8% of the member states in our region to date have a specific AI strategy, and another 14% say that they are in the process of developing one. Whilst many countries, 2/3, have cross-sectoral national AI strategies, many countries say that they still lack legal clarity, and 86% of countries responding have identified legal uncertainty as a critical barrier to adoption in the health system. So I think what we see also from this report, which, as I say, you will have with you in a few weeks from now, there is a widening gap between the potential, the aspiration, and implementation in practice, as well as uneven uptake across the region. So this GDO, in line with other existing GDOs, will fill the identified gap, the gap that you have identified, by providing technical assistance and country implementation support and research. And above all, the GDO will focus on capacity building in countries. This can range from advising on model, legislation, supporting facilities, and enacting the appropriate guardrails, as well as generally building the knowledge, the expertise, and the skills that are very much needed in the public health leadership. So where we would like our countries to be is, rather than being in a reactive and catch-up mode, to be able to really steer and manage the transformative role of AI instead of just responding to industry offerings. We have set up a technical advisory group to help us to plan these capacity building initiatives. So we are already, let's say, very much laying the ground as we await this decision. But let me emphasize that the mother program, Data, Digital and AI, will remain based in Copenhagen. What does this mean? This means that your data, the data that you submit to WHO in the gateway, will reside here in Copenhagen. And the GDO will be an extension and allow us to support all countries with capacity in a timely and responsive manner. We also hope that this will allow a community of practice and change leaders to be developed, and will allow us the space to build and continue to build solidarity between the region, between those countries that are more advanced and those that are still lagging somewhat behind. I seek also to assure you that the proposal is fully aligned with the direction being adopted by headquarters, and we will continue to respond as headquarters is also in the process of updating its global digital health strategy, and as Euro, we will of course be involved and be contributing to that. So this should not be viewed as decentralizing our work, but building the capacity we need to serve countries better. Thank you.
Thank you so much, colleagues. And back to you now as chair, but I think our regional director would like the word. Thank you.
Thank you, and thank you to my colleagues for, I think, was quite articulate. And let me here on the issue of quality of care and patient safety, thank the esteemed Minister of Health of Greece, who has been supporting a lot our work. Thank you so much, Madam Secretary General, and I know for your Prime Minister also very important. And I want to thank also Switzerland for the, I remember, the 5th Global Ministerial Summit on Patient Safety in Montreux, I believe in 2023. So it's really a core function, but for which effectively we do not have any core funds in the regional office. But Natasha highlighted many good points, but one is that we have the model program here. I remember from when I arrived in 2009, this was always discussed, right? We don't want fragmentation. There's a very strong program on service delivery and health workforce with the regional advisor Thomas Zapata under the leadership of Natasha. So policy-wise, this remains in the mother house, as I told yesterday, the normative powerhouse in Copenhagen. Then on the artificial intelligence, I also would like to express my heartfelt appreciation to the Minister of Health of Portugal, Ana Paula Martins, who has been supporting us a lot so far with a very important grant. And my concern is there that we are going to miss the boat because this area is moving so fast. I also understood there are some important questions which were raised by some member states. So my plea would be that we see an approval is not the kind of the end stage, that there is time to have these clarifications in a very transparent way. Many of you commended how we were so transparent on the EPW2 development, so we can follow definitely a similar transparent process. On the headquarters, what I see is they're developing, and we have great relation with Alain, the global strategy, bringing to the EB, but this is a global strategy. This is not the capacity building for the countries for which this is the role of the regional office, and also the capacity to be here. And then we also learned our lessons on financial sustainability, in the sense that if there is a certain portfolio, that contracts are only given for the duration of the funding, so that there will be no any financial liability. I think that's very important. And then a colleague mentioned, I think also another very important point, that yes, Hans, but the organization is globally contracting, and then you may, like, it look like a little bit beefing up, but actually this was a very good lesson that the esteemed colleagues from Iceland taught me. And I think we also discussed with Björn from Sweden, that if you have to do a contraction, contract to the maximum, so that you can allow also some little bit oxygen for new initiatives. Because otherwise we're doing more of the same, and the world is changing. So even in times of contraction, that's actually what I did 5 years ago. Because remember what I told yesterday, I was faced with a significant salary gap of $15 million. So we filled the gap, but the one area we beefed up was communication, which at that time I learned from Toyota when they had to do. And it really served us very well. We had a paradigm shift in communication. So this time we contract. We saw through the strategic human resources exercise we did with David and the team, looking, do we have the skills and the competencies in our workforce to implement the EPW2, that definitely in the field of the AI, we need to nudge it a notch up. So that would be my appeal, really. And then on the economy of well-being, this is in your hands, right? But I heard from Finland, this is important, but definitely, I mean, there is absolutely, I can reassure you, no any core funding over there. Because if already we have to implement the portfolio, what we heard this morning on the economy of well-being, but this is, of course, I leave in with you for decision. Thank you.
Thank you for this, Hans. And with this and the explanations that you give, I would be happy to open the floor to member states and to see what you have to say, and to give the floor, starting with Denmark, and then take it from there, whoever wants to raise his nameplate. Denmark, you have the floor.
Thank you, Chair. I'm delivering this statement on behalf of the EU and its 27 member states. We thank for the presentation of the 2025 Accountability Report. We commend this comprehensive exercise, which continues to set a standard for higher accountability and transparency. These values are central to our collective work. We strongly support the continuation of this reporting and underscore the importance of maintaining a high standard of accountability and due diligence, especially in challenging times like these. We particularly welcome the emphasis on making WHO Euro a model workplace. Staff at all levels are the backbone of this organization, and their well-being must remain a top priority, especially in times of restructuring and financial uncertainty. We are fully aware that the current situation has a profound impact on staff. Please be assured of our continued support and consideration for all WHO workers during these difficult times. The progress made in fostering a respectful working environment is highly valued and should be sustained. We also appreciate the continuous commitment to further strengthen the prevention and response to sexual exploitation, abuse, harassment, and violence, including through improved due diligence with WHO Euro's implementing partners. We thank the Regional Director for promptly addressing the financial shortfall. Measures taken to right-size the organization while simultaneously engaging member states, non-state actors, collaborating centers, and networks demonstrate a balanced and pragmatic approach. These partnerships are vital in softening the impact of reduced resources and ensuring continuity of core functions. The report makes clear that new forms of engagement with member states are needed. We welcome the first steps outlined, including efforts to better demonstrate WHO's added value to our residents and thereby strengthen public trust, especially in the context of growing dis- and misinformation challenges. This narrative is essential for the sustainability and legitimacy of our shared mission. We look forward to the next steps. We appreciate the commitment to participatory governance. The active role of the Executive Board and SERC members has been instrumental, and we would welcome more timely mid-year updates on their work to the wider membership. However, we still lack sufficient clarity on WHO's overall priorities and how they relate to those of other global health organizations. The upcoming months will be crucial to resolving this. As the global health landscape continues to evolve, it remains vital to support WHO as the cornerstone of the global health architecture. The WHO's mandate in international health, in line with its constitution, especially Article 2A, is crucial and should be fully reflected in the work and decisions of its governing bodies. In conclusion, the EU and its member states reaffirm our support for the Regional Director and WHO Europe. We stand ready to work together to safeguard accountability, strengthen trust, and ensure a resilient organization that delivers for all people in our region. I thank you.
Thank you very much, Denmark. I would like to pass the floor to Norway, followed by the Russian Federation.
Thank you. Chair, Regional Director, dear colleagues, this is a group statement, and I have the honor to deliver this statement on behalf of Estonia, Denmark, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. We appreciate the efforts that have been made to look for creative solutions to address 3 technical areas in the business cases that the Regional Committee is being asked to consider. We would also like to commend the Regional Office for its dedicated work in restructuring the office and managing an extensive portfolio of projects and responsibilities. We recognize that this has been both a challenging and necessary process, and that much of it had to be undertaken within a very tight time frame. While we all recognize merit in the technical areas being proposed, we have different concerns regarding the impact of additional GDOs on the regional office and how their establishment will affect prioritization, as well as the potential for increased fragmentation or duplication across different levels of the organization. Most importantly, we all have significant concern regarding the timing of this discussion. The organization is experiencing significant changes with substantially smaller budget and workforce. The new program of work, EPW2, has just only been approved, and the reform process within the regional office is still ongoing. Establishing 3 new DDOs will have strategic, operational, and financial implications for years to come. We need to have a better understanding of how these offices will serve the entire region and how their funding will be secured beyond the initial contract, and what their establishment will require directly from the regional office in staff and funding. We are concerned we will be putting the cart before the horse if we initiate the process as requested in the draft decisions, without having more clarity on the ongoing reform process. The establishment of new GDOs also needs to be considered in the context where we have several existing GDOs. We would like to better understand how their role and functions currently contribute to avoiding duplication and ensuring targeted activities and coordination across the region. We do not find ourselves sufficiently prepared to make an informed assessment of the validity of the 3 business cases at this time. I would kindly suggest that the Regional Committee postpone taking any decision on this issue until the Regional Committee 76 at the earliest. The coming year would then provide the opportunity to clarify the strategic, financial, operational, and governance concern that we have raised here today, as well as in the Member State consultation, in anticipation of consideration of the business cases at next year's Regional Committee. Thank you.
Thank you very much, Norway. I'd like to give the floor to the Russian Federation, followed by Greece.
Thank you very much, Chair. Regional Director, colleagues, we would like to thank the Secretariat for the prepared proposals. The Russian Federation on the whole supports the decision to open the 3 new GDOs. But at the same time, we would like to stress the importance that the government of countries in these territories, which will be hosting these GDOs, will have a transparent and non-discriminatory access to this. This needs to be on the basis of scientific research, and we need expert support and invitation to these GDOs. The principles of these offices should be equal accessibility for all countries, experts and institutes of the region. We all participated recently in a high-level meeting on NCDs on the sidelines of the General Assembly of the UN, and we looked at the issues of GDOs but opening that office in Moscow was rejected only for political reasons. But this would help many countries in the fight against NCDs. NCDs are growing across the world, and states are introducing progressive measures, but some countries in the European region are acting against the interests of their own population for political reasons. We believe that healthcare should not be politicized, and we call on other countries of the region to reject these biased political narratives. This is necessary so that we can go back to basics, where joint work of different political views from different countries will help us to significantly reduce the disease burden in many countries. Thank you.
Thank you very much, Russian Federation. The next would be Greece and then Slovenia, please.
Chair, Regional Director Dr. Kluge, delegates, colleagues. It is a pleasure to take the floor as today we consider the proposal for a new geographically dispersed office on quality of care and patient safety. The technical and business case before us makes a strong argument for why this area deserves focused and sustained attention. Across the WHO European region, member states are striving to strengthen the safety, effectiveness, and person-centeredness of care. The proposed office would help us do this in a more systematic way, by connecting countries, pooling expertise, supporting the development and implementation of national strategies on quality and safety. Since 2021, the regional project on quality of care and patient safety has shown what is possible when countries work together with the WHO and partners. Through this collaboration, practical tools have been developed, national frameworks have been assessed and improved, and an active community of practice has emerged, linking policymakers, professionals, and patient organizations. These are not abstract achievements. They translate into safer hospitals, more reliable services, and a stronger culture of learning across systems. The proposal presented today builds directly on those lessons. It is technically sound, financially realistic, and clearly aligned with the goals of the second European Programme of Work. Most importantly, it responds to a need expressed by countries themselves for a regional mechanism that supports collective learning and capacity building on quality and safety. Greece supports the proposal wholeheartedly. It represents an investment in the credibility and resilience of our health systems and a commitment to every person's right to safe and high-quality care. Thank you, Chair.
Thank you very much, Greece. I would like to give the word to Slovenia, followed by the UK.
Thank you, Chair, Director, distinguished colleagues. Slovenia aligns with the statement by the Denmark on behalf of the EU, and Slovenia thanks the Regional Director for his continued leadership for presenting the 2025 accountability report. We commend the regional office strong commitment to participatory governance, accountability and transparency, which remain the foundation of trust between the Secretariat and Member States. We particularly appreciate the regional director's personal commitment to inclusive and participatory governance, ensuring the member states are actively engaged at every stage of policy development and implementation. We also value the transparency and determination demonstrated in addressing challenging financial circumstances. For example, the new arrangements for cooperation between the regional office and member states have been established through open and transparent consultations, joint prioritization, ongoing dialogue and flexibility. This approach sets a model of engagement that could serve as an inspiration across the entire organization. We also value the regular reporting by the regional director and his team to the standing committee of the regional committee and open briefings for member states, which provide member states with clear insight into progress, challenges, and decisions being made. This practice has greatly strengthened confidence and ownership, fostering a genuine spirit of partnership. Slovenia welcomes the steps taken to enhance the efficiency and inclusiveness of WHO Europe's governing process, including the strengthened role of the SCRC. We look forward to actively contribute to its working, supporting its function as a vital link between member states and the regional office, and as a mechanism for continuity and accountability throughout the year. On the matter of geographically dispersed offices, Slovenia deems that all the 3 business cases are well funded and needed for our region. These are very important topics to ensure sustainability, equity and performance of our health system in the fast-changing world, and for us, international collaboration in these areas is essential. Therefore, we absolutely support the adoption of the related decisions. Slovenia reaffirms its full support for WHO Europe leadership and remains committed to working together towards strong, transparent and participatory governance in our region. Thank you.
Thank you very much, Slovenia. I'd like to give the floor to the UK, followed by Switzerland.
Thanks, Chair. The UK welcomes the accountability report for 2025, and we'd like to just highlight 3 aspects quickly. Firstly, we recognise the impact that the current crisis is having on staff well-being, as we said earlier, and really encourage WHO Euro to continue to ensure staff are supported during this very difficult period. Secondly, we are grateful for WHO Euro's efforts to increase the visibility and the awareness of the SCRC and its work, and we support continued close working to improve transparency and accountability. And thirdly, we welcome the 2 new key performance indicators to enhance WHO Euro's performance monitoring mechanisms and effectiveness of governing body meetings, and support efforts to deliver against those indicators. So thank you. On the GDO proposals, and I'm one of those with some history on this, we recognise there's a clear technical value across the 3 policy areas. But like others, there are other considerations. To be honest, we found it challenging to assess the alignment of the proposed GDOs against Euro's strategic priorities, as the EPW2 was only agreed today, and we've heard that on some issues there are further reports coming. We do worry that increasing the number of GDOs will lead to fragmentation of effort at a time when we need to focus more tightly. If we're to agree to proceed with the development of any new GDO, we need to be confident in the WHO Euro value add, not just the importance of the issue per se. And we need to understand why the work is better delivered through a GDO rather than through prioritisation at headquarters or a different format, for example, making more use of collaborating centres. Having said all of that, we've heard clearly from Natasha and the regional director, particularly on the AI proposal. And that has been something that we've been considering for a number of years now. So we wouldn't want to stand in the way of that moving along to the next stage. But the absolutely key question we would need to answer, if that is the decision that we take, is whether any other organisation is either providing or better able to provide the capacity building and support to member states that you're currently envisaging provided by WHO Euro. Thank you.
Thank you very much, United Kingdom. I'd like to give the floor to Switzerland, and unfortunately, because of time, in the interest of time and the rights of reply, I would say that we finish up. I mean, Switzerland would be the last member state today, and we will postpone the discussion for tomorrow, right? So, Switzerland, you have the floor.
Thank you, Chair, the Regional Director. We thank the Regional Office for the 2025 Accountability Report and note the recommendations of the SCRC regarding the business cases for the 3 proposed GDOs. While we recognise the value of existing GDOs, we wonder whether, given the ongoing realignment and the need for flexible resources, whether the GDO model remains the most effective way forward. We would be keen to better understand the underlying rationale and would like to raise a few overarching points. We seek clarity on the distinct added value of the proposed GDOs in comparison to existing capacities in Copenhagen and elsewhere in the region. We would also welcome an explanation of the implications should one or more of the business cases not be approved by the Regional Committee. How would this affect the regional office's work in the 3 areas, and what alternative approaches have been considered? We have heard from several delegations that, in particular for the AI-related proposal, there is a need for additional resources and capacity. While we recognize the critical importance of this topic for our health systems, we would appreciate a clearer understanding of the specific functions that WHO can fulfill with its expertise in this area and how a GDO would support this. We understand that the final decision on establishing any GDO will return to the regional committee next year, once concrete hosting proposals are available. In the context of shrinking resources and prioritization efforts at the regional and at the global level, we believe that continued communication with member states would be beneficial, particularly with regard to areas at risk of underfunding. We would welcome the Secretariat's guidance on how such updates, taking into account the concerns raised by several member states today, could be shared in a pragmatic and efficient manner without diverting attention or resources from critical work in these areas. Thank you.
Thank you very much, Switzerland, and I apologize for everybody who was not able to speak now. Do you want to?
Thank you. Just to confirm that as the chair is proposing to suspend the item because we're running short on interpretation time, and thank you to the colleagues in the booths who've been with us. We have taken careful note of the flags that are still raised, and the item would suspend and we would return to it tomorrow. So we've taken careful note of those. Please leave them raised just for a moment till I'm certain that my colleagues have recorded them. Thank you. Thank you, Chair.
Thank you very much. So we will come back. And for this, let's come. We only have a few minutes. Come to the rights of reply. I would like to give the floor to those delegations that requested the exercise to their right of reply earlier in the day, or the ones that would like to make use of that now. I would like to remind you, and kindly, that you should limit this to 3 minutes. And again, if there's subsequent requests by delegations for additional spoken rights of reply, this will be limited to 30 seconds, as we have done in the past. So actually, I have Poland on the list, so maybe we can get started with Poland.
Thank you, Chair. Dear colleagues, we are delivering these rights of reply on behalf of a group of like-minded states in response to the earlier statement by the Russian Federation. Despite the distorted narrative, the European Union was not part of the voting procedure. As you know, the EU was not even present in the room during a closed session for member states. Apart from that, the European Union is always consistent with democratic principles and in accordance with the rules of procedure and the advice of the WHO legal service, which we have no doubt in. Thank you.
Thank you, Poland. I assume Belgium and Finland, you still had your name plates up from the previous. Is there anybody else who would like to? I see Ukraine. Please, Ukraine, you have the floor.
Dear Chair, distinguished colleagues, Ukraine takes the floor to exercise its right to reply to the statement delivered by the representative of Russian Federation. We note that the member states of WHO European region have made their position clear. Russia candidacy for election to the WHO Executive Board was not supported. This decision reflects a principled stance by the region grounded in the fundamental values of the World Health Organization and international law. We recall that a state that wage a war of aggression, targets hospitals and medical workers, and deliberately devastates public health system cannot credibly aspire to a leadership role in the world foremost health organization. Today, at approximately 9 a.m. this morning, the Russian Federation shelled a children's hospital in Kherson. 9 people were injured, including 4 children and 3 health workers. 1 is in critical condition. Even as in this very session, the Russian delegation advanced idiosyncratic interpretation of international law and procedure, a children's hospital was under fire. WHO surveillance has verified over 2,000 attacks on healthcare in Ukraine since 2022. Systematic, not incidental. The pattern is grim. Children and pediatric facilities are repeatedly targeted. From the 8 July 2024 strikes on Ahmadit, Ukraine's largest children's hospital, to today attack in Kherson, and the ICAC arrest warrants concern the unlawful deportation of Ukrainian children, with UN investigators documenting continued evidence of such transfer. By rejecting Russia's candidacy, the countries of the European region have reaffirmed that such action of incompatible with the principles of global health, cooperation, solidarity, and humanity. Ukraine expresses sincere gratitude to all members that upheld these principles through their vote. Thank you.
Thank you very much, Ukraine. I see the Russian Federation has raised its name tag. Please, you have the floor.
Thank you very much, Chair. Well, it seemed to us that all the arguments during the previous discussion have been heard, but nonetheless, we see that some colleagues have missed out the main point of the previous discussion. What we need to do is observe international law, and when the European region, over the course of a long period of time, is taking certain decisions, then these decisions, as it turns out to be, need to be observed regardless of whether it is a decision that they do not like. But in our view, it is extremely important to continue to observe our rules. As regards what we've just heard from one delegation, so the issue of attacks on medical facilities, on a number of occasions we have submitted information to the World Health Organization, and anybody who wants to look at this issue objectively can familiarize themselves with this information, that on the territory of the Russian Federation, medical facilities repeatedly, hundreds of times, have been attacked by Ukraine, but this information is being ignored. Medical workers and children are being killed, and at the same time, at this forum and in many other fora, information is submitted in a one-sided manner.
Thank you, Russian Federation. I don't see any other nameplate raised. For that, I would propose that we come to an end for today's day 2 of RC75.